as we look at the ways to align the system to be able to lead to the best outcome for patients, there needs to be an incentive at every level. And so if you design a system that leaves out, say, providers is receiving some incentive for the right clinical outcome for a patient, the model likely will collapse. So you have to make sure that you're making the right investments at each part of that healthcare delivery chain to lead to the right outcome for patients. Maria, at the beginning of this part of the questions you asked, it's like, hey, how are things kind of differently happening in regions? And we work all across the country,
Right.
but we see a lot of variety. And I can say when we talk to maybe one payer and we think we've come up with a really good innovative approach, and we take that that same model and try to lift and shift to another one, it might not work. Their data architecture may not be able to track information flow in the same way. Their agreements with, if it's with a payer, their agreements with their provider network might not allow what we're talking about doing. So kind of a lesson of looking at a geography as large as the United States is that you have to think big, but you really have to know the local markets to be able to execute value-based payment systems and value-based care effectively.